let's see. All right, welcome everybody to our weekly update. Today is Wednesday, October 14th, and we're here to give you some information and then answer any questions that you might have. So the first thing I'd like to start with is that we did extend the independent insurance for iPads. So families have an option of buying iPad insurance, and there's a deadline because once the deadline comes, then we can start sending in broken ones. But we had a few parents call and ask if we could extend that. And this Friday is the final deadline for buying your own external insurance. That information's on the webpage, and it's through the Right Group Insurance Company. I believe it's $40 for the year if you want to partake in that. But we will not be extending the deadline for iPad insurance beyond this Friday because we need to get a few back. Hello, Mrs. Koya. And here we go then with some half days. So even though we're in a hybrid model, we still need to do parent-teacher conferences. So we will be utilizing a Wednesday for 3 hours. It's kind of the hybrid Wednesday. But at our K-6 buildings where teachers will set up appointments to Zoom meet or phone calls, conferences with parents. We're also going to be doing our Halloween for K-6 on the two groups, A group and B group. So Tuesday the 27th will be a half day and the Halloween celebration in school for the K through 6 students on Tuesday, October 27th. And then Friday, October 30th will be another half day for our B students for their Halloween celebration and then some staff development. So the 27th and 28th are our first two parent conference days, and you should be getting information through Schoology or Seesaw if you want to sign up for those conferences. We will be adding some dates in November as well as an evening conference time for parents that teachers will be available, so more information to come on parent conferences. The other piece I want to talk about a little bit is about COVID. So the district, since last week, remember we said we had no official cases. We do have 2 cases in the district now. And some of the things we learned going through our first and second case is that when the person takes the test, so say I go for a test on Friday and I don't get the results till Monday or Tuesday. On Tuesday, when we get the call that someone was positive, if they took the test on Friday, the Department of Health will call the family as well as the district, and they will ask the family where they were for the last 48 hours because they backtrace 2 days. And then that's when they make the decision if other students or teachers or anywhere you've been with a family party or any event that you were at needs to do contact tracing so that we can get those people in quarantine till we know that they're safe for 14 days. In the cases that happened in the district, the student did not come to school for those 4 or 5 days before the test, got the results, and when they went back, there was no need to trace back into the school because they only go back the 48 hours, and then they go forward. And that's basically what the Department of Health, and you can go on New York State or Niagara County Department of Health to see this, is that from the onset of symptoms, they'll usually start to show symptoms if that's where they went for the test, within 48 hours of contacting the disease. So we also know that there are people who are asymptomatic all the time and could be positive, and we don't know that. But in our case, the 2 people who had positive COVID cases were not in the building for the 2 days prior to getting the test and then finding out they were positive afterwards. That's another great reason why we have the 5 days off for students when they come in the hybrid model. Monday, Tuesday, they're not in school. Wednesday, Thursday, Friday, Saturday, Sunday, and vice versa. If you go through the Thursday, Friday, it's 5 days. So that helps us keep the infection rate down. And across Niagara County, the cases in schools have been very low. I know that there was some news about Niagara Falls, but that was actually traced back to being brought into the school from another area. It wasn't spread too much in the school until that person came in. So every case is different. I know parents want to know like what happens exactly, but it depends on where they were, when they were tested, and that's how we proceed. I will give a lot of kudos to the Niagara County Department of Health because they're very thorough. They do call us right away. They answer our questions. If the nurse or the principal has any questions, then we call them back and we get those answers for them. And so it's been a very good process, and we're very happy with that going forward. So as we're planning, as we come up on the 10 weeks, and I told you that we were doing some internal meetings. We did have one last week and this week already for what it might look like in week 11 and beyond. We're going to do a thought exchange starting next Wednesday. And when I do the Facebook Live, we'll put the link up there live as well, put it out on Facebook and on the web page. But basically, we want to hear from the community, and we're going to use thought exchange to do that. What's working well in the hybrid model and what needs to, or remote, and what needs to improve. And our focus really is on how to improve the remote model going forward, especially K-6, spending a lot of time there to see if we can't get more teacher contact. I had a long meeting today with the union from those groups, and it was very productive. So I think we'll have some nice changes going forward. So going back to COVID cases in the district, and since last Wednesday, and both came in, I think one was Friday, and then one over the long weekend. They were calling me on my cell phone and contacting me about that to get that started. I want to remind everyone again that Friday is the last day for iPad insurance if you want to buy that separately. We do have half days coming up the last week of October, which will coincide with the Halloween celebration for our K through 6 students. And then the thought exchange that'll start next week. Let's see what we got. Good afternoon. Why weren't we notified of the positive case at the middle school sooner, even though the student was remote? Kind of threw us parents off with our weekly updates. So I'm not exactly sure. The day we found out from the Department of Health, we did notify the middle school parents right away through that. There was no need to do a district-wide one or do any quarantining based on what I just explained. So the day we find out is the day that we send the notification to the parents. So when someone says, Lynn is saying, is it in the middle school? My son is supposed to start back tomorrow. The person who had COVID goes to the middle school, but there is no live cases in the middle school. So as we find out, no matter what building it's in, we're going to either do the contact tracing where the Department of Health will call you directly, as well as the district doing a more global notification if we need to quarantine more than that person. In the cases we have had, they've not needed to quarantine more than that one person. So yes, as I mentioned, there's 2 cases in the district. One is at the middle school and one is at Drake. Both follow those same criteria. Why are the remote kids being marked absent? Work on my kids' end is being done daily. They should be going in and fixing that. So Amber, if that's something that you're noticing, I don't know how you would see that on your end, but if you know that they're being marked absent or you're getting the call, I would call the school and see. It could be a glitch in the computer system. How do we get the iPad insurance is if you search, iPad insurance on the web page, you will see the form that needs to go home. It was also sent home with people when they picked up their iPads. And I believe it says replying to Kathy, so there's the link for the iPad insurance that someone was asking for. Are progress reports updated in the parent portal? if an error was found. So I need maybe a little bit more information on that, Michelle, but if you're saying the parent portal had a progress report and there was something not correct in it, I'd start with the teacher or the principal, and there can be updates made through those systems. It may not show up until the report card that it's corrected, but there is a way to fix that. Did the school district get the testing that was supposed to be here? So Niagara County Department of Health got 5 rapid testing machines, and they did it by size of district. And our day is next Wednesday, but it is only for staff, so bus drivers, custodians, teachers, aides, administrators. They're just doing a sampling of the people who work in the school district, and then that'll be posted. The good news, they did Niagara Falls and Lockport already, and the cases were 0 in Lockport and only 2 cases in Niagara Falls that came up positive. They're in Niagara Wheatfield this Wednesday, so that's taking place right now. And then our staff will have an opportunity to voluntarily go for a random testing on the 21st. They'll be getting information on how to sign up for that later today. Okay. My son is being marked absent as well, and he does the work daily. Every day, at least one class, he's marked absent. So I'd kind of the class that he's being marked absent in, or start at the building attendance call there and see what they can do to help you with fixing that. Good afternoon. I truly appreciate the update and communication from the district. You spoke to the fact that there may be some changes coming along with the hybrid and remote. Does this include more teacher-student contact time for students with IEPs? I know everyone is doing their best, but the 2 days is very difficult for students that need more support. So yes, I have a meeting with the special ed department, which is the IEPs for individual education plan. And we're going to be looking at the numbers we have and how many we can accommodate and how we can maybe get kids back in. We're also working at the different levels for accessibility to teachers during the day when kids are trying to do the work. So it'll be different for each grade level though, and it's not as easy as it might sound. So we're trying to involve the teachers quite a bit with this time to sort of see, what they need for their workload and what makes sense for parents and accessibility. iPads. Okay, you had said prior to school starting that you would reevaluate at 5 weeks with the COVID rate, which is where we're at. If low, you would see about opening schools up after 10 weeks. I would think only 2 active cases. Okay. Yes, so that is a good thing that we only have 2 active cases, and we are going to try to get more kids back. The issue is the state is not changing the restriction, even though we have low positive rates in Niagara County to the social distancing. So in order to maintain the directive from the governor that says in order to open, you have to guarantee that you will be able to social distance between students 6 feet apart. The rooms aren't big enough to bring everybody back. But we will be looking at the 10-week mark to sort of get more kids into the hybrid model because we do have seats available every 2 days, A or B. But as far as a 5-day-a-week program, we would have class sizes of 25 and 30 then, and then we would be breaking the law basically of reopening, which is say you have to social distance your kids. My daughter's grade was wrong for one of the classes, and the teacher told me that it was an error, but I'm not showing that it has been updated in the parent portal yet. Well, I don't know when you talk to the teacher. Remember, they were off Monday, so sometimes it takes a few days. If not, I would your best bet is to just keep in contact with that teacher, and before the semester ends, I'm sure they can fix that. No children are being tested by Niagara County or with the rapid testing. And the reason we're doing a Wednesday is because there's no kids in the school. And the teachers have a little bit more flexibility for their time. It takes 15 minutes, so they'll need to schedule a time where they can go to get the test and be out of the room for 15 minutes, but no kids. Okay, thank you. I know this process is not easy. There are many factors. I'm glad to hear there are discussions about changes to the grade 6, K through 6. What's the protocol for students seating on the bus? Is it one child every seat or every other seat? So if you're in the same family, you can sit together. Their 60 passenger bus can fit 52, or I'm sorry, 22 students on it with the social distancing. And each, depending if it's a big bus or a small bus, that might be every other seat. It could be across the aisles, maintaining social distancing. But the only time you should see two kids sitting in the same seat together is if they're in the same household. Uh, we still remote if that's what we choose. Yes, until there's a vaccine and the social distancing requirement is taken away, you'll be able to pick remote. Once schools are open back up and full, remote will not be an option, but that would only be because they're sure that COVID's not an issue anymore, and the governor would lift the restrictions that schools are operating under. Um, we are really doing quite well here with only 2 active cases. I know it is flu season coming up, and just because a child is sent home with symptoms does not mean if they even get the test that they have COVID, right? They could have a regular flu strand, they could have a regular cold or allergies and that type of thing. So it is one of the frustrating pieces of this disease is that there's no sure way to tell. We do take the temperatures, we do ask the right questions, we do work with parents and their doctors, but at the end of the day, we have to follow the guidance from the state. And that is posted as well on our webpage, the new toolkit guidance for active cases or testing. And they basically break people down into an A, B, and C group. A being the person who tested positive, B being people in that same household or in contact daily with that person, and then C, if you had contact but not on a daily basis. So we follow those quite religiously for a good reason. So a lot of conversation about the absentee marking. We're working on attendance because it is a problem for everybody across the state. And you either mark everybody absent and then go back in and mark them present, or everyone's marked present and you have to go in and mark them absent. Teachers could have been called to a meeting, there could have been a sub, there could have been a slip of the wrist on the button and it got hit. So if you're really concerned about the absentee marking, I would, contact the building and see if they can correct that and see what's happening. But it wouldn't be uncommon that you're marked absent until the teacher gets time to go back in and mark you present for the day because they're working all day and then they go in later and see who accessed what when. So it's not real-time attendance. Yeah, so we've had some issues with our reporting. Someone's asking, is the case at the middle school or NTI? So when we put in the middle school case, it actually first showed up as Spruce School, which is wrong. So we called the state, big, huge process to get that changed. And then they said, hooray, we changed it. It no longer shows Spruce, and we thought it was fixed, and it shows NTI and not the middle school. So there's sadly one person at the state who does all this, and we have been in contact with them. But there's 2 cases, one middle school, one Drake, no other buildings. I'm going to do places at once. I'm going to end up losing my job if I have to keep leaving to stand next to him to make sure he's participating in remote schooling. I truly hope there will be more than 2 days. I would say to Courtney that it's probably going to stay at 2 days for the near future because I don't see a vaccine in the near future, and I don't see our governor releasing the requirement for social distancing. So there's just no possible way to fit them all in. If this says, what is the process if a child is experiencing cold symptoms but no fever? or if displaying allergy symptoms. If they come to school and they're sneezing and rubbing their eyes and coughing and that, they'll probably be sent home. Then you have to go to the toolkit to see the procedure, and the nurse can walk you through it. The quickest way is to get a COVID test. If it's an ongoing allergy that you know that this child has, there is another process in the toolkit that shows you what to do with the doctor's office to clear them to come back. If Mr. Fox, our web person, is watching, he can maybe put the link to the toolkit up for you so that you can kind of walk yourself through it, because again, it depends on the case. All right. I called the middle school today and talked to the secretary or of the counselors. They are aware of the absent problem and they are not worried about it as long as they are doing their work for that day. And it shows that they're there. So, yeah, you might be more concerned about the absentee rate than other one. Oh, someone just sent me a note that says if iPad insurance ends tomorrow, not Friday, please mention it on live. So it's the 15th, not the 16th. So I'm sorry about that. But if you're going to get iPad insurance, you have to do it by the end of the day tomorrow. Ed Strasser Jr. is our transportation director, and he said it's one student per seat with siblings able to sit with each other in the same seat. Kind of what I said. Is the state decision. As of right now, hybrid and virtual stands as is, correct? That is correct. So yes, that's what we're looking at, but we're looking at enhancing the virtual piece of it because we realize that some kids need a way more support than they're getting. So we are working on that. Just so someone's asking every other seat on the bus. If allergies or cold symptoms with no fever, is it required to have a COVID test? If allergy or cold symptoms with no fever. So, again, on that question, you would have to go to the doctor and he would have to certify that it is just a cold or allergies. You can't just say it's just a cold or allergies, accept them. The doctor might not be willing to do that if they haven't seen your child in a while or it isn't a pre-existing type of allergy, and they may require you to get a COVID test as well. It's the only way to keep our numbers low. So I know you might not want to have your kids tested, but that's the best method, and that's what they'll work you through and walk you through. So yes, if you get a cold, it means you could be out of school for a while if you're not willing to get a COVID test. And if there are a lot of doctors' offices won't see you because they don't want you in the office if you're sick and have possibly COVID until you get a COVID test. So it's not just the school districts. We're trying to work with the pediatricians. We're trying to work with the Department of Health, and then over all of that comes New York State with their guidance, and he likes to change those things on a dime. So we're working to try to keep that up. Thank you, Mr. Fox. He just posted the toolkit link for the COVID-19 information. So if typing in COVID-19 in the search bar on the web page is too taxing, all I have to do is click this button, and it'll take you to the toolkit. It is a pretty easy to use form, but there's a lot there. So you have to kind of take your time and read each bubble, and then it'll show you where to go next for what has to happen. I appreciate it. Where would I drop off my kids' physical and immunization forms for this year since my kids are fully remote? If they've been in the district before, I would take them to the school so the nurse has them and can update it that way. If they're new to the district and you chose fully remote, I would probably bring them to the administration building at 176 Walk Road, and we can inter-office mail them to the district. But the best bet is for the nurse to keep her records updated because they're the ones who have to track that. Okay. So as we go through the coming weeks, I want to be sure that if we get a COVID case again, where there's going to be contact tracing, which means they go back 48 hours and they think it's going to affect kids or teachers or any staff or sports teams or anything like that, we would do a general global call telling you that we had another positive case and it's at this building and you may be called by the Department of Health. Lots of times, the Department of Health will start that process before they even confirm it with me, if they've gotten reliable information from the parent. So there's two ways that you might be able to get information, or you may hear it from the district or the Department of Health first. I will say that I've taken a few phone calls from parents that said, my son or daughter wasn't feeling well. I took them to like a Well Now clinic to get a test, and they said there that they'd be surprised if they didn't have COVID because they have so many symptoms, and then I never hear back again. So those parents tend to then want to warn everybody, and they go on Facebook and they say, my kid was tested and probably going to have COVID, and people get whipped up. The best bet is to just wait for the school or the Department of Health to contact you. And just because there's a live case, like we have two in the district, doesn't mean that your son or daughter was anywhere near it or affected or in danger at any time. It's really no different than being with a family member on the weekend, and then Friday they find out that they were positive because they didn't feel good on Wednesday and they got the result on Friday. They probably won't go back to the following weekend to notify the rest of the family. I'm not saying it wouldn't be good practice, but that means you have to then quarantine for 14 days and get COVID tests. So I guess be careful what you wish for. They told me to keep doing what I've been doing. I can't. I'm going to end up unemployed with the dropout for a child. So I do know, which isn't a great answer or for a public school superintendent to be telling you, but there are some private schools that have way lower enrollment that are taking kids 5 days a week because they only have 10 kids in first grade, so to speak, or in a grade level. Those are the only things that I know of that have kids in more than the 2 days a week. At the most, kids are in 3 days a week in some districts, but nobody, unless they're a very small district or a small private school, are doing 5-day instruction. So I know I don't want you to lose your job, and I feel for you, but there's just no legal way public school districts can offer you more than possibly the 2 or 3 days a week. So they're still talking about transportation and how they sit on the bus, so hopefully that's helping. Yeah, someone's suggesting, what about a tutor? Courtney, I don't know what grade level it is, but maybe there's a friend or a neighbor or something who's in the same boat as you, and you can kind of work out a system with them to help. And then, yes, there's always the private school option if you really need to have them somewhere. But I'm assuming the issue is money as well, and private schools aren't cheap, right? And tutors aren't free. So we get to the point where across the country we have a lot of people like you who are really struggling for that, and I am sorry for that. Hopefully there's a cure soon and we can get back to 5 days a week because that's what we're all hoping for, and to get back to normalcy. So I will continue, and it usually is pretty active for the next 48 hours when people watch this video later, and trying to answer questions or send it to the building. I know it's public, and you might not want to tell me a lot about the school on Facebook or in a message because everyone can see it. But really, your best bet is to call the building that your child's in. If you're not having results there, then you can call the superintendent's office and we can get you to the right department or see if what help we can get you. But I wouldn't stress too much about attendance because that's just basically a bookkeeping thing at this point. But we do use it, like we have some kids who are not engaging at all, and then those are the families we're prioritizing, reaching out to those families to sort of say what's going on. We don't see them online, they're not coming hybrid, how can we help you? So we use it more for that than anything else. So please don't stress too much about the attendance piece, but we'll try and fix it and get it as current as possible. Until next week, and hopefully I can report that we have no more cases, but if we do, I'll report it again. And stay safe and stay strong, and let's have a good, healthy week and get into the end of October here with no more cases. Thank you, everybody. Stay safe.